Welcome everyone to podcast. My name's Ken Rethmeier, and it is my pleasure to have an opportunity to do these podcasts using my book as part of the foundation. But this year, I've been very, very fortunate to find some leaders that I've known over the years who identify and have the qualities and the competencies of what would call great leaders. And today I'm going to introduce briefly, and then we're going to come back to Michna in a second, my good friend, Dr. Mihnea Samoila, who lives in Bucharest, Romania. And he reminded me just a little while ago that we actually met in 2014 when I was part of a three-person group that did a program on leadership in Brussels. And I was fortunate enough to have Michna as I was his executive coach. And then in 2019, he was very, very instrumental in helping me and two other colleagues, I mean, Tony Smith and Kasia Shabanowska out of Maastricht University, to come in and do a leadership program for 25 hospital directors. And it was a wonderful experience. So I'm going to share the screen and have a few words, and then we'll come back and I will have Michna introduce himself in a more formal fashion. And these podcasts that I've been doing over the last couple of years are based on my book that I published in 2016. And the first chapter, the model that I created for that one is see, believe, and achieve. And that's all about how leaders have a responsibility and an opportunity to do things in their organizations that are unique. And so these podcasts that I'm doing with people like Michna, it's all about the deeper dimension of being a leader. And I think it's very important to recognize that leadership comes with some responsibilities, but great opportunities. And the model that I use is creating excellence through capacity, capability, and confidence. And I translate those into capacity, which is seeing something that others can't see. That's the vision for the organization and the direction we want to go. And I really started this model, interestingly enough, based upon a quote from the artist Degas. And Degas said, "It's my responsibility to not only see what I can see, but to help others see what I see." And that's about art. But that's about leadership, and capacity is vision. Leaders also have the opportunity to help their organizations build their capabilities through learning, development, and so forth, to be able to believe in what they're doing. And when they believe, they have the unique capability at that point to do things that you would never guess. And then when you put those two together, pardon me, they drive the ability of the confidence of the people there to achieve uncommon results. So as a leader, it's not what you can do. It's how you can help your team and organization to see, believe, and achieve. And I say words to the effect that leaders have the opportunity and obligation to add value every day, on target, on time, every time, without fail. Well, let's take a look at Dr. Samoila's history. As you look at these, I met Dr. Samoila when he was the medical director of Petrom. And I remember him describing some of the things he did with that organization and led that organization through the COVID crisis with incredible results in helping that organization be prepared from a perspective of preventing disease, but also looking towards how he could help them be better prepared for that COVID problem. As you can see, besides his MD degree, he's got an MPH from Maastricht University. He has served as a health consultant. And I think the very interesting thing that I'm going to have him talk about is what were those competencies that really helped him achieve some of the results he has achieved, and especially now that he's working with the European Investment Bank for the past 2 years and some of the very innovative things that he's working on, the new healthcare delivery solutions you see listed here. And he is also a visiting lecturer in the Department of Public Health at Cluj, Napoca. And he and I have a mutual friend there by the name of Marius Ungaranu. So let's get started. I'm going to stop sharing the screen and I'm going to turn the microphone over to Michna. So Michna, tell the audience a little bit about yourself and what are those things that you really prized yourself in what you've been able to do as a leader. Sound, your microphone's muted. No, your microphone is muted. Turn your microphone on.
Hope you can hear me now.
Yes.
First of all, it's a pleasure and an honor to be in your podcast and to be on your list of leaders to be interviewed or to having these podcasts with. And I would say you have an important contribution to this, to the place where am I, and
You're
to
very kind.
my career and how it developed since we met. And you see, I have also your book with me, and it stays in a special place here in my home. Um, uh, what to say? So I would say it was a long journey from the professional point of view I had, while first exploring the clinical medicine, which I enjoyed, but also from various, let's say, reasons having to do with the context of delivering health services in Romania. I got very motivated to do and to be part of a change which can serve larger communities, which is public health.
Yeah.
And gradually I got closer to this area. I was I would say an important step was to graduate a master in public health in Karolinska University in Stockholm. And in Maastricht it was the LEFI training, which is also an important step in my development, where I also met you. And where I learned something very important, that leadership is not only a nice to have or let's say uh, a genetic capability, but it's something where you could invest, develop, and even more, you can have a lot of passion in this area. And this I learned from you. So to have this different perspective and to look also in the mirror and to look at yourself as to where are you as a leader. Of course, this in relation to what you want to build and what added value you want to bring in your professional roles. And getting back to my professional roles, before we met, I'd say I had a first touch with a position which involved management and leadership and change, which meant that I had to implement a quality management system at the national level in the surveillance network of laboratories, of public laboratories for infectious diseases.
Mm-hmm.
And this was my first, let's say, practical endeavor, and get a quite important taste on how it is to change, and how fascinating can be change. Also, how much work you have to put in change, how persistent you have to be, how consistent, and so on. Um, and another important step in my career, as you mentioned, also it was the longest time I spent in a place. It was with OMV Petrom, the largest oil and gas company in Romania, which also it was an opportunity for me dedicate important resources to healthcare, to the health of their employees and the health of the communities, and spent a time as a corporate health manager, more focusing on health promotion campaign and behavior change among the employees, and then as director of the medical health provider comprising a network of 25 clinics serving OMV Petrom. And this is the place where I've been in the pandemic, which actually, and I can come back a bit later, which was indeed, I would say, uh, one of the most challenging situations I have been put into, but also I would say one with the most successful and let's say rewarding and meaningful results, uh, which I would say I have obtained uh, not only through hard work but also to leadership capabilities developed since I worked with you, also from the
You're
times
very kind.
you have been my coach. And not to speak, so the first project, which was part of the LEFI training from Maastricht, the training on leaders for European public health, uh, it was a very nice project of branding and integrating all the health services in the company under one umbrella, which was also a classical change project, which had to be approached with, let's say, quite scarce resources, but in a smart way, and putting a lot of leadership abilities in it to be successful. And it was, and since then, I think the employees, but also the company itself had felt the change and increase in added value in matter of this area. Um, After the OMV Petrom time, I was exploring, and it is also part of my, let's say, preferred areas in public health, the digital health part.
Mm-hmm.
Um, and this led me also to opening or starting a company which actually works now more for serving communities, remote communities in rural area in Romania,
Yeah.
while digitalizing rural caravans. So bringing let's say effectiveness and this modern perspective of digital health in the processes and the work which is done at this level.
So
Of course, setting the ground for developing, let's say, connections and engaging the patients on a proper pathway to more specialized services in the national health system. And now I got in the area of consultancy, as you had been for many years, which is, I would say, very challenging from the leadership perspective. uh, um, but on the other hand, can benefit from all the capabilities a leader has. While you have to remember, you have to serve the customers and also the communities for the projects which are built. So I'm a
so
consultant with the European Investment Bank, a health consultant, working in various areas of health projects, from development of regional hospitals in Romania to development of the genomics national strategy.
yep.
So from soft to hard topics, but all in all, again, I would say also in this field, emotional intelligence, people related aspects matter a lot. Of course, technical aspects are important. Of course, hard work is important. But if you don't put this set of competencies above these prerequisites, which of course have to be there, I would say results are very hard to achieve. Also, considering that healthcare is a cross-domain area, a multi-stakeholder environment with multiple interests, multiple organizations, which are very difficult to handle. And I stop here.
And so, what I want the audience to look at is, based on your history, it illustrates very clearly how leadership is a developmental process. You just don't turn it on automatically. It's something you build from one area to the next. And in your case, your foundation at OMV Petrom really provided you an opportunity to start exploring those competencies of innovation, creativity, and looking for uncommon results from the challenges that you were facing there and translating those into the leadership skills and competencies that you are using now with EIB and some of the other work that you're doing. And I think one of the important things that people ought to listen to on this particular case is how you were able to translate that into a new way of providing healthcare to the rural parts of Romania. And, we often think in healthcare about the big cities, the major healthcare systems and where they're located. But in many cases, and this is true even in the United States, where I used to live up near Winston-Salem, North Carolina, it's a rural area. And sometimes those people don't have access to what healthcare ought to be provided. So you were instrumental in doing that and are doing that today. So if you think about some of the leaders that you've worked with or what would be the key competencies that you would say this makes them different from everybody else?
Oh, yes, it's a complex but also simple question, because if I think at two instrumental leaders I have known and I had the chance to work with, there are common competencies
Mhm.
for both of them. And here I'll name the CEO of Petrom, Mrs. Mariana Gheorghe, with whom I had the chance to work for many years. And she is an acknowledged leader in Romania. And with you, Ken.
Well, thank you.
And actually, I was very rich because I had both of you from different perspectives at sometimes the same time in my career. And maybe it's also because I was already prepared a bit to open the eyes towards leadership. I have chosen also this LEFI training where I met you.
Mhm.
So getting back to the common competencies, I would say I would put first passion,
Mhm.
passion,
Yeah.
and then emotional intelligence. This is something which contaminates, I would say, which passes from one person to another,
Yeah.
um, which builds the energy, the momentum, which is the catalyst, I'd say. Then, of course, you have to have the other ingredients, and this is also something I met. It's this kind of, I would say, credibility, which is not emerging in a one-time effort. Uh, this is built due to consistent, persistent efforts, long-time efforts, which give the community you lead or the followers, they give them confidence. They give them the necessary confidence, um, and this is again uh, coming back to the Lefi training, this is something you as a coach created for me. It's actually the necessary environment that I can give my best. And I did. And
You're
going
very
beyond the
kind.
limits and beyond your comfort zone. And this was also with Mrs. Mariana Georgie. So she was always pushing me and us, my colleagues, to go, and the management team in Petrom to
Yeah.
go beyond our limits, beyond the comfort zone, but with her as an example. And this matters a lot. And one more
Hmm.
ingredient, which I also saw it works also for me. It's authenticity.
Yes.
Not only being honest and transparent, but being authentic, being yourself.
Yeah.
This is
Big
something
point.
which is again, uh, it maybe it cannot be rationally recorded, but it can be felt. Uh, yeah, and uh, yeah, I would stop to this. Although, yeah, there are. If we look more in a more, let's say, comprehensive way, and I get back also to the competency metrics you said.
It's interesting you say those things because what it brings to my mind, and I know you know this, is that great leaders have the ability to build trust with the people they work with and who they work for. And that trust then provides a wonderful foundation upon which you don't have to do it all yourself. You can turn to the people that you bring into the system or you get involved with, and they do the work. And I remember when we were developing the Leadership Excellence for Healthcare, the LEHC program for 2019 in Bucharest, working with the Foreign Investments Council, FIC, and you and the others, it was a wonderful opportunity to see how when leaders can translate, to your point, their authenticity, their honesty, and their passion for what they do, it's incredible what you can achieve. And I know that the audience probably can guess that Michna Samoila was recognized in 2015 by a very important organization for being one of the best young leaders in Romania. And that was well deserved because the work that I've had the opportunity to do with Michna has been incredible. And it's been my pleasure and my privilege to know him, his family, and the work that he's doing. Michna, what kind of any closing comments you'd like to pass along to the audience about leadership?
Only, I would say two comments. One related to the Leaders for Excellence program, uh, where you have been in Romania in 2019, uh, as a, let's say, lecturer and program manager. It was, I would say, beyond the expectations that a group of highly experienced hospital directors,
Hmm.
who most of them or many of them were also at top level in their academic career. So you'd expect that they don't have too many things to learn. This kind of setting uh, leaves also room, always room for learning, and changed a bit the paradigm. They put themselves in the position of students, and they were really passionate students,
Yes.
which was unbelievable for me. This transformation, which I would say any leader should go through this transformation and through this cycle always. And getting back to the competencies, one more, which I've seen in you and I've seen in Mrs. Mariana Georgie, and I tested also during the pandemic myself. It's building purpose
Yeah.
or creating purpose for the people around you. It is fantastic what can unlock. Uh, uh, And at the first sight, doing all this, let's say, um, pandemic preparedness and management for an oil and gas company, which was a critical company with a lot of pressure and a lot of expectations and a lot of unpredictability in that time, would have been a huge challenge. Also, due to the fact that we had to stay separate, sometimes more from our homes and so, and mainly because we created purpose in between the team. The team worked in a fantastic way. Because I think it was the one opportunity when everybody's seen how health is important and critical for a company which apparently doesn't have to do too much with health. And it worked. So, and I think this can work in everyday work and on day by day basis.
Well, I'll tell you, Michna, you have provided some summary comments that are very critical, as you know, to the success for leaders. And I want to thank you again so much. I've actually been in Romania 3 times, twice with Project Hope, teaching healthcare management, and then getting to work with you and the others on the leadership for excellence in healthcare. And for me, it's been a privilege, an honor, and I sincerely appreciate your participation today. And I'm going to sign off with, again, a huge thank you so very much. Please extend my kind regards to your family and the others who remembered this old guy from when I was there. And at this point, I'm going to stop the recording and we'll go offline for just a short while.